put your health in your hands. Africa's #1 rated health TV show, numero uno, as I like to say. Thank you for joining us today. My name is Dr. David Ajibade with the Brain and Body Foundation. Today, we're going to be talking about the elderly. That means those in this. In fact, as far as I'm concerned, 60 doesn't even qualify for elderly. We're talking about those who are in the 70s and beyond. As you know, Nigeria and other African countries, not in terms of life expectancy, we're not doing really well at all. In fact, Nigeria, out of 54 countries, we are like number 3 when it comes to worst life expectancies. 54 countries in Africa, I think the average life expectancy is about 54 years of age. Compare that with the US or Japan, where it's 80s and above. Although in recent times, because of coronavirus, the numbers have kind of slipped a little bit. But it's 80, compare 80 with 54, 55, that's terrible. However, we are beginning to see more and more of our parents and grandparents live longer. So that's a good trend. And what that means is that we need to start paying attention to the health needs of the elderly people, because this is, for many of us, this is really uncharted territory. I don't think we had any, I don't remember rotating through in medical school, rotating through any specific classes on geriatrics, which is the study and the treatment of elderly people. So this is a new concept for many of us. And so that's why I'm really, really happy I could have my friend, classmate, former classmate in medical school, who is actually a geriatrician, which means he focuses on treats the elderly people and their conditions, disease conditions, and of course, helps them maximize their elderly life. So without much further ado, I'm going to say, welcome, Dr. Adekunle Adedeji. How are you, sir?
Very well. Good evening, Dr. Ajibade. Good evening, viewers. I appreciate you having me on your program.
Thank you. Okay, so now that we've dispensed with the formalities, you're Adekunle to me, I'm Dio to you. Feel free
Dio to me. Right.
Absolutely. So again, I appreciate you coming on the show. Our goal, as you know, and you and I have had several discussions on this, is to really, we want to break things down. We're not going to talk, this is not about talking medical stuff as much as it is about the insights, the tips, the principles, and the tools that we can pass along to the man on the street, the man who knows nothing about medications and medical health and longevity and all those things, so that they can know what to do, and probably even more importantly, what to avoid when it comes to even starting from their youth and their 40s and 50s, so that when they become 60, 70, and 80, they won't regret, oh, why I did this, or why I didn't do this. So let's start with the first question. What are some of the things that you consider to be common mistakes people make in their earlier years that comes back and affects them adversely in their later years?
Okay, thank you. So I think looking at that, I would, approach it from what the system does to us and what individuals would do to themselves. So what we have, especially in Nigeria, is a system that has not given a lot of attention to the elderly. It's a system that does not prepare the youth for when they become, 65, 75, 85. And, like you said in your introduction, it may be because we have somehow agreed with the life expectancy that we see, and we think, okay, yeah, if they can get to 70, then we're good. So I think some of the common mistakes that the system has allowed is not to have a good screening system for diseases that come, as you grow older. We may have the facilities to do it, but we have not emphasized for the people to check that out. So because when you are 50, for example, and nothing is done to check for colon cancer, for example. It may start developing at 50. It may not show its face until 65. So the person developed a polyp, which is a little ball in the intestine that grows to become cancer. It takes about 10 years, averagely, to get to that point. And so if we don't take care of that at 50, it will manifest in the 60s. If we don't find it in the 60s, it will manifest in the 70s. So it looks like it happened in old age, but it started in mid, in the mid 50s or the 60s, and then it manifests when the person is 80, 90. The same thing goes for all these other things that can be screened. Prostate cancer is another one. Breast cancer is another one. These things can be screened early enough and identified and treated before it becomes, a real clinical problem. So I think that's one big thing that we have not done well at. And I know there has been changes. I know things are better than before, but we can still do a lot more. That's from the systemic, the system point. From the individual aspect is also taking care of ourselves. When we take care of ourselves when we're young, then what we find as we grow older is that we can resist diseases. When we do exercises, when we take supplements, that helps to build up our immunity. When we eat the right kind of food, when we go to the doctor to make sure that our blood pressure, for example, is good, that is individual. We don't, even if the system is not there, we can go and say, I want this checked, I want this checked. And when we do that, we find out that we can prevent so many things. Or if something happens, we're strong enough to fight those diseases. So I think for your question, it would be from a preventive standpoint. And we have to imbibe that habit or make that a culture where we're able to check things out. So for example, the blood pressure, same thing with the screening. If the blood pressure is high, you may keep a blood pressure high for many, many years. And then one day the person gets a stroke. But we forget that they started 10 years ago, maybe even 20 years ago, and nobody paid attention to it. So looking at those things, what we feed ourselves, what we do to our bodies, what we do to our teeth, for example. We have, if the teeth is bad, you already set up for problems. If you
say a little bit more about that, because as you know, we've had Dr. Luadara on the show too to talk about teeth issues. But let's talk about it from your perspective.
Okay, so from my perspective, so we have the mouth that, of course, is the gateway to feeding us, to making us healthy. If we eat the right thing, we're healthy. If we take the right medication, we're not healthy. So look at the teeth. The teeth is responsible for chewing and making sure that we start digestion very well. If we are not taking care of that very well, and then we end up with little or no teeth, then what we can eat begins to reduce, especially in a culture where we have a lot of chewing to do when we eat. It becomes very difficult to really eat well. Medication is another part. The kind of medications you take affects your mouth, your teeth. And people need to know that. We need to ask questions about the medications they're giving us. Will it affect your dental structure? Will it affect the teeth? And if it will, what are the things that you can do to prevent that? Do you
have any examples on that medication that will affect the teeth?
For sure. Things like a seizure medicine, phenytoin for sure would affect the teeth. Diuretics, which is blood pressure medication that we take. So for example, in Nigeria, we take a lot of diuretics. That
to reduce the salt.
Right. Exactly. So it may not be directly impacting the teeth itself, but what it does to the mouth in general, the dryness, that would eventually affect the teeth. And we just need to know that. If we know that, okay, maybe what can I do? Do I need to drink more water? Do I need to moisten my mouth? Can the doctor change the medications? So knowledge about these medications, very, very important. People who have asthma, for example, and they do a lot of inhalation, steroid in their mouth, they need to know. If we have knowledge of those things, then you can ask questions on what can you do to make that better or to avoid those problems.
I like that. Those are really good points. And when you were saying about colon cancer, especially when that starts 10, 15 years in advance. So having people have those regular checkups, especially after the age of 50, is super important. I understand that even for Black people, they even recommend it starting as early as 45 because it seems
45
to be worse among the Black people. I don't know what it is, Kunle, about us. Why is everything affecting Black people so much? I don't get it.
One of the things is that we are late in starting things, and so these guys go on data, right? They go on history, so we find out that we can't really give a good data of what we have done, and so there's going to be a lot of assumption. Okay, if you guys don't have it, then we'll give you the worst. So, for example, if we find our colon cancer at stage 4 all the time, then it becomes a problem versus the people who are able to find a polyp that is not cancerous and deal with it. And so they assume that, okay, you guys, it's either it's too aggressive or you are missing something. So let's do it earlier. If a lot of people are getting this later stage disease, so let's do it earlier. So they have all kinds of reasons for that. But I think for us, is to get in and at least do something. There's simple tests that we can do, like blood in the stool, that may not even be as invasive. They may not be as expensive. If the government can come in and say, okay, let's make this one of the things we do. Let's make mammogram one of the things we do. Primary health care, that we have all these primary health centers. How many of them are able to do mammograms? How many of them are able to give a little stool card? If we can't do colonoscopy, at least we can give a stool card, and we can start from there.
Absolutely. We're going to take a short break now, a brief commercial break. When you come back, folks, there's a video about me speaking with some elderly people in their 8th decades. The youngest person there is probably 75 or 76. So just to buttress some of the tips and ideas that we're trying to pass across here. So we shall see you after the break. God bless.
Okay.
Hey everyone, Dr. David here, and I am with some remarkable people. We're playing cards, and to be on this table, you have to be able to buy in. You probably have to be like 8 decades or thereabouts. So I'm lucky to be here. So I'm going to kind of like, I'm going to go around the table. I'm going to talk about, each person is going to say their age and 2 or 3 or more secrets they have they can share with you for how to live a long, healthy, happy life kind of thing. So we're going to start with Jen. Well, you're not even 80 yourself too, but tell us how old you are.
I'm the young one here. I'm only 70. Well, David's younger, but I'm 75. And I just look at the positive. I enjoy life. I have so many friends, so many things to do. My schedule is way too busy, but I love it.
Okay, cool.
Okay, I'm Nancy. I'm 81, and I try and eat healthy and exercise and just walk as much as I can and keep busy.
79 years old. I enjoy life. I have a home in Seattle. I have a home down here in Yuma, Arizona. I stay busy. I think that's one of the most key important parts of this whole thing of longevity is being active.
And having a good sense of humor too, right?
Pardon me?
Having a good sense of humor.
Yeah.
Well, I have a good sense of humor. Yeah, that's just part of life. If you don't have a good sense of humor, you're not having fun.
That's right.
Right?
Right.
That's right. Jan?
I'm Jan, and I'm 81, and I've never drank or never smoked. I think positive. I love life. I'm happy all the time. I work hard, and I don't sit around much. I don't watch TV a whole lot, but I love to be with people.
That's about it for me.
Well, you keep yourself really busy with all the tools and repair
helping
work
the
you do,
neighbor.
and helping the neighbors. There you go.
And the doctor.
I'm way over the hill, and I stay active. I brush my teeth every morning, and I drink healthy.
How old are you?
How old?
Way over.
No, you're not gonna tell, huh?
You're not gonna get away.
I don't have that many
86
toes in my
or 86.
fingers.
86. Okay. Well,
And he's up on the roof when he shouldn't be.
that's right. He's up
Shame
on
on
the
you.
roof.
Serious.
All right. Well, thank you, Lucky. Okay, so back to me. Thank you, everyone. This is really, I got it to say, I'm telling John, remarkable. I am in awe, really, of everybody and how active they are. Everybody's, I see Lucky rising up from the couch, and he's like, he gets up sprier than I can. I mean, he gets up easier than I can from the couch, and I'm a little over half his age. So this is really remarkable. I hope we can share learn some of these lessons back home and apply for some of them. So thank you for listening. Bye.
All right, welcome back, folks. I hope you enjoyed that short clip. Those were really interesting people. I remember one of them was on the rooftop. He was fixing his roof at 87. I'm like, what in the world? We would never allow that in Nigeria. So anyway, so let's talk about, I'm here with Dr. Adedeji. By the way, my apologies. What is the name of your practice in, El Paso, Texas, USA?
Oh, my office is called Kingsway Medical Center. We're in El Paso, Texas, and I am an attending physician at the Hospitals of Providence and Las Palmas del Sol, both in El Paso, Texas. So I do geriatrics and some general medicine.
Nice. Love it. All right, let's get back into it. I wanted to take our attention back a little bit to what you mentioned about colon cancer, starting like many years before it eventually manifests. And that sparks my memory, my thoughts about things like dementia when the brain and the memory begin to fail. What we know is that happens on average 2 decades, 20 years before it eventually begins to manifest. Things begin to go wrong in the brain. And unfortunately, we don't have some people refer to as a cognoscopy, as opposed to a colonoscopy. A cognoscopy where they constantly check your memory and your mental health ability to see how well you are performing for your age. So I think that's an important thing, especially as our parents and grandparents are growing older these days, right?
It is, and I think one of the problems we have, going back to talking about the life expectancy, one of our limitation is that we've had we have not had a lot of people getting to that age bracket where we would identify this as a big problem. We have a lot of misconceptions, when we see somebody with cognitive impairment and we think they're witches, we think they're just saying things, and we do things that we're not supposed to do. So dementia is real. It's a struggle anywhere in the world. It's a struggle in the Western world. It's going to be a struggle in Nigeria or in Africa as a whole. I think the first thing is to identify and know that it is there, and to be able to understand that this is not a crazy person. This is not a person that is pretending, because that happens with family members anywhere. This is not limited to our culture. Anywhere, if you're used to somebody being active and all of a sudden they're misbehaving, or they're telling you that you came in and stole something from their house because they forgot where they placed stuff, then it becomes a difficult thing, and that will happen to anybody. But bringing it back to us, I think that the first thing is to know that these things exist, and then know how to prevent as much as we can, and know how to start identifying the things you see, which we call symptoms, the symptoms that you see. How do you identify that? And then what are the treatment options? How do you support that? So going to prevention again, the blood pressure is always going to be a big deal. We have a lot of high blood pressure in Nigeria, no doubt. I do some little medical mission once in a while, and I go to rural Nigeria. At least 70%, and that is being very, very, conservative. At least 70% will have uncontrolled blood pressure.
Wow.
Out of that 70%, I can tell you that another 50% out of that 70% would only get medication when a team like that goes there. And so if you are not giving them medication for the year, you are not really treating their blood pressure. How does that affect dementia? People with blood pressure, high blood pressure, would have what we call mini strokes. Would have little spots in their brain that over years turn out to be what we call vascular dementia, because they've had a lot of tiny strokes which did not manifest as a stroke the way we know it, which is, you have some paralysis of the limbs, they can't talk and all that, but it's structurally happening in the brain. And over the years, that becomes, a reason for somebody to have some kind of cognitive impairment. That is one. The other things, vitamin B12 deficiency can cause a kind of dementia. Thyroid deficiency can cause a kind of dementia. So all this versus, the popular Alzheimer's dementia that we all know about. There are all these other things that can happen and cause symptoms of dementia. So if we're able to take care of those things, so if we reduce the number of people with uncontrolled hypertension, then we reduce the number of people with vascular dementia, for example. If we take care of our patients, or of our family members, if family members know to go to the doctors, if they were going to the doctors at 40s, at 50s, at 60s, it's no longer a problem to go to the doctor at 70. So, but if we are not used to doing that, then to wake up at 70 and start going to the doctor when you haven't done it for 70 years, it becomes a problem. So if we prevent things and we're able to, go ahead.
It's so easy. What the things you're mentioning, they're so simple and straightforward. That's, the whole idea of a penny of prevention, and how does, I've forgotten how the story goes, but the saying goes that a penny of prevention can save a pound of cure, or something like that. Because, let me just reiterate some of the things he has said to folks. Ensure you're taking your medication. If you have high blood pressure, if you have high blood sugar, you need to take your medication as well, because that can also compromise the brain. But you mentioned things like vitamin B12, for instance. That's it's a link to what is known as homocysteine, which can affect brain deterioration. Other things I would mention too are things like vitamin D, vitamin C, zinc, which is known to be the most important mineral for the brain, magnesium. So some vitamins have these things, but they don't have it in the right amounts. But even if you're taking them, if the least you can do is just take a multivitamin, don't think that because you are eating a balanced diet, you're having everything. There's a lot in this modern day. That balanced diet is not what it used to be 50 years ago. So you do need to be taking some kind of supplementation. If you start with a multivitamin, that'll be great. You need more vitamin D, like we talked about. We also know that potassium is lacking in a lot of elderly people. The older you get, the less potassium you have in your body. Potassium is extremely important for the cardiovascular system. So those are really, really important things, Kunle, that I think you pointed out. And I hope in our next session, I hope we can talk about it some more, because it seems like my producer is saying that the time is up. So I want to say a big thank you for this time you've taken for us to do this, and please be sure to show up again next week so we can continue this discussion.
Thank you, Dio.
Any final words you want to give our viewers?
I think our viewers, everybody wants to be healthy. Everybody wants the best. We need to do some work towards it individually, and we hope that our government also would help in bringing some of these things in place. But like you said, the least we can do is to make sure that we take our supplements. I think it's very important to, and maybe next week we'll talk about that more, but I think, like you said, that single multivitamins, yes, it may not have the amount that you need, but that's the first step. And then we can now deal with how much you need, how to find out how much you need, and then hopefully we can do that next session.
Perfect. Thank you very much. And thank you folks for joining us. We will see you again next week. God bless.